Welcome. We are presenting the association between school bullying, suicidal ideation, and school disorders among school-age children from Antioquia, Colombia. I am Natalia Cardenas, part of the research group in Psychology, Health, and Society from the research line Childhood, Adolescence, and Youth from the University CES. I am with my colleague, Jessica Quintero, which is the first author of this paper. Our colleagues Nadia Morato Vázquez and Beatriz Caicedo Velázquez are part of this project too. And we have the advisory of the Dr. Dorothy Espelach, which is at the top of the speakers in this international event. So we would like to let you know about our research line in childhood, adolescence, and youth. In this subject, which is our interest in bullying at school, we have been conceptualizing this term since 2008, more than 12 years. We have been interested for the perceptions and coping strategies that the schools, parents, and teachers implement to address bullying. We have been contextualizing in prevalence of school and the associated factors in the 9 subregions of Antioquia. We have been doing the validation of a questionnaire called the CIEA, a short questionnaire to determine if there is bullying at school, in the schools, the validation of a school climate, the validation of psychosocial interaction variables, and the validation of coping strategies, which are some instruments that we are working in. Also, we have been doing the association in these variables: family dynamics, school climate, self-esteem, self-efficacy, optimism, locus, social skills, coping strategies, self-control, use of psychoactive substances, suicide, and eating behavior. Next. Also, we have a core strategy where which consists in our published papers, such as the validation of a short questionnaire to detect school bullying, the family as a predictor of school bullying in Antioquia, school climate and family functionality as a factors associated with school bullying in Antioquia, the association between school bullying, suicidal ideation, and eating disorders and school age, which is the paper that we're going to present, and book chapters such as educational context and vulnerability and prevention, bullying school, prevention and intervention. We have been doing training such as the International Symposium to School Bullying, which is a very well-recognized symposium and event in Colombia, which is supported by the Ministry of Education. Also, we have been doing national meetings and webinars, and also we have been part of research networks such as the UNESCO Chair on Screening and Evaluation of Early Childhood Development, the International Observatory for School Climate and Violence Prevention, and the Bullying Research Network. Also, we have been doing advisory and consultancy in the schools, parent networks, family, children, and adolescents. Now, my colleague Jessica Quintero is going to present the paper. Thank you.
Thank you. I'm going to present the study. First, the introduction. We currently know that bullying is a pervasive problem associated with this phenomenon. The mean prevalence of bullying victimization in Latin America is 29%, similar to the worldwide prevalence of 32%. Bullying is also associated with numerous long-term deleterious psychological and health outcomes, such as depression, anxiety, consumption of psychoactive substances, suicidal ideation and behavior, some somatic problems, school problems, and 2 of them are particularly striking for as in Latin America, those are suicidal ideation and eating disorders. Suicidal ideation prevalence for adolescents in Colombia is around 6%, and it has been increasing last years. And for eating disorders, these are the prevalences for anorexia, bulimia, and binge eating disorders. It's important to take into account that for binge eating disorders and bulimia nervosa, prevalences in Latin America are higher than in Western countries. It could be due to some cultural issues and characteristics in Latin America, such as the importance that food has, the affective importance that has for people in Latin America. Family functioning is also associated with suicidal ideation and eating disorders. That is the reason why we took this variable into account as a control variable. So the objective of our study is to investigate the association among between school bullying, suicidal ideation, and eating disorders among a large sample of school-aged children from the Department of Antioquia, Colombia. Conducted a cross-sectional study. The population were students from grades 5 to 9 enrolled in public school in the urban area of the department. Here you can see the department red constitutes the 13% of the population of the sampling was made through a multi-stage sampling. First, we chose 40 municipalities through a systematic sampling. Then we chose the school in those municipalities. Was chosen by a proportional sampling, and then we selected the groups through a random sampling. All students in the selected who signed the informed consent were participating in the study. So the final sample was 3,220 adolescents. The instruments used for this study were suicidal ideation, the PANSI, positive and negative suicide ideation questionnaire. For measuring eating disorders, we use the SCOF Colombian validation. For all these measures, we use the Colombian validation of this questionnaire. For measuring, we use the abbreviated CIEA questionnaire, and for measuring family functioning, we use the 5E Apgar scale. For the analysis procedure, we used the STATA program in the 14th version, the data analysis. We calculated the prevalence of suicidal ideation, eating disorders. For the univariate analysis, we use the chi-square test, and for analyze the associations, the Poisson regressions. Our sample were children, adolescents between 9 and 17 years old. The majority of them were in this age, 9 to 10 years. The 51% of them were females. This was important for us that 62% of our sample had some level of family dysfunction, severe or mild dysfunction. Only at 37% of the sample functional families, and students who had medium to high risk were 32% of the sample. Well, for the results, this table 2 shows the crude and adjusted analysis, the association between school bullying and suicidal ideation and eating disorders. The prevalence of suicidal ideation was 37% and the prevalence of eating disorder was 17%. It is higher than the mean prevalence in Latin America and in Colombia. It calls our attention because it's significantly high. Suicidal ideation was higher between those who had severe and moderate family dysfunction, and among those with medium to high risk. Well, according to the crude regression, adolescents exposed to medium to high levels of school bullying have had a significantly high risk of suicidal ideation than those adolescents with lower risk of school bullying. This was a 38%, you can see a 38% higher risk of suicidal ideation than students with low risk. Regarding eating disorders, the crude analysis showed that adolescents with high to medium exposure had 4 times higher risk of having eating disorders than those adolescents with low risk of bullying. Family dysfunction was a variable that in the crude analysis was associated, but when we did the adjusted analysis, controlling by bullying, the association was lost. It was not significant. And one of the main findings of this study was that those students with severe family dysfunction had 4 times higher risk of presenting suicidal ideation than those students with functional families. In conclusion, adolescents exposed to medium to high levels of school bullying have a significantly higher risk of suicidal ideation than adolescents with low levels of school bullying. Our findings also contribute to the association between bullying, age, gender, and adolescent mental health outcomes because we did not find a significant association between bullying at the school and suicidal behavior with age and sex. The results of this study also provide evidence of the relationship between exposure to bullying at the school and an increased risk for eating disorders. This study also reports a marked tendency of an increased prevalence of suicidal ideation as the level of family dysfunction increases. And this study concludes that school bullying has significant association with mental health outcomes in school-aged children, while describing the relevance of functionality as a factor. The participants' position in personal relationships, such as link situations. And this is it. Thank you for your attention.
Thank you very much.
Bullying is a serious problem in society, and we need to do everything we can to make sure that the equestrian sport, the horse riding schools, and the stables are safe environments for everyone. Together, we work with empowering youth leaders, and we call it Trygga ledare, to empower children and youth through mentorship and value-based leadership.
Friends is a child's rights organization and our vision is a world where no children are exposed to bullying.
The Swedish Equestrian Federation, we have over 150,000 members, 19 equestrian districts, and we educate thousands of children and thousands of leaders every year. Thanks to the Stenbeck Foundation, we are able to strengthen the positive social climate for all children and youth within equestrian sports. Together, we make significant and long-term difference.
In order to do a knowledge-based planning and follow-up of the project, we started with a benchmark analysis. The analysis consists of two parts, a survey and interviews. We saw a comprehensive commitment for a value-based leadership and social sustainability, but we also saw needs for even more support, knowledge and trainings.
Based on the benchmark analysis, we have developed new tools and methods that we are implementing within the educational structure of the Swedish Equestrian Federation. Children and youth are really important co-creators of empowering youth leaders. We have met and educated thousands of children as well as young and adult leaders, and based on their needs and experiences, we have implemented supporting structures that empowers children and youth through mentorship from adults. This is part of a broad, systematic approach to further implement the project together with leaders, educators, and individual members of the Swedish Equestrian Federation.
Good afternoon. My name is Ryan Broll, and I'm a faculty member at the University of Guelph in Ontario, Canada. And I am delighted to be able to share some of my work at this forum. Today, I will be speaking about experiences of post-traumatic growth among youth who have experienced bullying and cyberbullying. As we all know, bullying, both traditional and cyber, is an all too common experience that contributes to a host of negative outcomes in nearly all areas of victims' lives. Sometimes these negative outcomes persist well into adulthood. For example, a 2016 study published in the Journal of the American Medical Association reported that about 1/4 of adolescents experience long-term poor mental health outcomes after being bullied. Quite clearly, being the target of bullying is a traumatic experience. Given the harms of bullying, most research, and nearly all that has examined outcomes, has focused on these adverse experiences. And this is very important research. But If it's true that about 1/4 of bullied youth experience poor long-term outcomes, then of course, about 3/4 of victims do not. For whatever reason, most survivors are less negatively affected. Note that I'm not suggesting they are not affected. Bullying is, after all, a form of trauma, but they nevertheless fare reasonably well, and it's possible that some may even fare quite well. A growing body of research demonstrates that it is normal to experience some form of growth after trauma, or as Yolanta Burke writes, pathologies are not an inevitable consequence of adversities. Instead, most people exhibit some resilience, and some people experience transformation or growth after trauma exposure. This is called post-traumatic growth, or PTG, which refers to positive psychological change experienced as a result of the struggle with highly challenging life circumstances. Many of us likely have some personal familiarity with the concept of PTG. For example, if you've heard somebody describing having a new appreciation for life or a sense of clarity around what's important to them after surviving a traffic accident or a serious illness, what they're referring to is the growth elicited from their exposure to trauma. In later work, Calhoun and Tedeschi identify 5 areas in which people may experience PTG. First, personal strength is when people realize that they may be stronger than they had imagined. Second, some people may develop new interests, and sometimes this is directly related to the trauma experienced. Third, people may feel a greater sense of connection to others and increased compassion for those who are suffering. Fourth, and especially if death or injury is part of the experience, people may develop a new appreciation for life and re-examine their priorities. Finally, some people develop a deeper spiritual and existential connection. Research on PTG among adolescents is new, dating back only about a decade, but it is clear that young people can experience growth after a variety of traumatic experiences. To my knowledge, only 2 studies have addressed PTG among victims of bullying. One found that visually impaired victims of bullying spontaneously reported PTG, and another reported that females were more likely to report PTG and that the duration and frequency of victimization was associated with PTG. These studies are important for demonstrating that victims of bullying have the potential to develop post-traumatic growth, but they're limited in that one focuses on a fairly specific population, and the other draws on a small self-report survey of 150 students in Greece. I aimed to build upon these works through a qualitative study of young adults who had experienced traditional bullying and/or cyberbullying in elementary, middle, or high school. This qualitative design allows for a degree of nuance that can be difficult to capture in survey research. Specifically, I asked whether victims of bullying in childhood or adolescence experience post-traumatic growth, and if so, in what areas do they experience growth? To answer these questions, I conducted in-person semi-structured interviews with a non-probability sample of 129 young adults attending a mid-sized Canadian research-intensive university. More than 80% of participants were female, with an average age of about 19.5 years old. About 2/3 of participants identified as heterosexual and about 2/3 identified as white. Interviews broadly focused on youth's experiences with traditional bullying and cyberbullying and their subsequent well-being. This presentation draws upon participants' unprompted remarks about PTG, as well as their responses to questions asking them whether or not they felt stronger as a result of having survived bullying. The results fall into 3 broad themes. First, a handful of participants reported that they did not experience PTG, or that they were uncertain whether growth had occurred. Far more participants perceived that they had experienced PTG, most of whom reported a greater sense of personal strength and improved relations with others. In the interest of time, I will discuss these themes in more detail. However, I will briefly note that some participants reported new possibilities. One became very interested in politics and social justice, for instance. and a few did describe having a new appreciation for life. The relative scarcity of growth in this latter domain may be a reflection of the fact that bullying is often not life-threatening, even if some participants did report suicidal ideation after having been bullied. To begin, some participants did not experience PTG after being bullied. These participants reflected on the ongoing negative impact of bullying on their lives, and they often described themselves as being weaker as a result. For example, when asked whether she felt that surviving bullying had made her stronger, Autumn replied, "Truthfully, not really. I'm wildly insecure to the point where it really annoys my friends because I can just go on for hours asking, does my hair look okay? Does my face look okay?" Others were unsure whether bullying had contributed to growth. Sometimes they felt stronger, but other times they did not. For example, Brooke said, "I've thought about that a whole bunch. If it didn't happen, I don't know what kind of person I'd be now. But sometimes I think it's made me stronger in certain respects, but I also think it's weakened me in other things." Maria similarly explained, "I don't let people take my energy if it's not useful, and I say no more often, which I think are strengths. But a lot of the time, I can feel very weak and vulnerable." Among those who perceived that they had experienced PTG, the most commonly identified form of growth centered on an awareness of their personal strength. For example, Basim said, "I feel like everyone should go through bullying. And it's not because I wish horrible acts on anyone, but it's because you wouldn't feel like you're confident. You wouldn't feel your self-worth if you wouldn't have gone through that. It actually changes you." Although Basim's perspective may be controversial, and certainly one would hope that there are less traumatic ways of encouraging adolescents to identify their strengths, other participants identified specific areas in which they felt they had become stronger since surviving bullying. For instance, several participants reported having improved self-confidence. One of these young adults, Bethany, said, "It took a while, but I learned how to express myself and say, no, this is not okay." Others described having developed a thicker skin and being less affected by others' perceptions of them. Among these participants, Christina explained, "I wasn't going to let people do that to me again. You know what I mean? It was pretty traumatic for me. I don't think I was going to let people bother me so easily anymore." Another oft-cited area of PTG was survivors' relationships with others. Many participants explained that being bullied made them more compassionate and empathetic and aware of how they interact with those around them. For example, Austin felt he had become more self-aware since being bullied. He said, "It definitely made me stronger as a person and made me more aware, I would say, and more vigilant of how I'm acting and what I'm saying, what's coming out of my mouth." Jessica similarly added, "I just always try to be nice to people, And if I know that someone's struggling or they're upset, I always try to be there for them because they say you should be the person that you needed." Other participants described forging stronger, healthier relationships after being bullied. These participants explained that they seek friendships that lift them up and that they are more willing to end negative relationships. As Felicia said, "I'm not going to say I'm picky with the people I associate myself with, but it makes me stronger because I know what I want and who I want in my life. And I know what I don't want. And if I feel like you're negatively impacting me, I will push you away. I used to not be able to do that." Other participants explained that they feel a desire to protect others who are struggling. For example, since surviving bullying, Abja had become a fierce advocate for improving the accessibility of mental health supports. She said, "I think it's also made me deeply interested in protecting people and building space for people." Much of our collective effort has gone into eliminating bullying, and important strides have been made. And I want to be clear, our goal should be to ensure that no child is bullied. Tedeschi and Calhoun caution that trauma should not be viewed simply as something that happens on the way to growth. It's important to acknowledge the harms of any form of trauma, even if humans are malleable and many will eventually recover. Still, as we work towards eliminating bullying, in the interim, we know that some will continue to experience bullying and that some will continue to experience long-term adverse outcomes. Perhaps if we better understand those who experience growth, we can better help those at risk of negative outcomes. The results of this study suggest that those who experience bullying can and often do experience PTG. Indeed, participants reported growth in 4 of the 5 domains of PTG, and especially in the areas of personal strength and their relationships with others. As they begin to recover, there may be long-term benefits to encouraging victims of bullying to recognize new strengths that they develop as a result of their negative experiences. Mindfulness training may be helpful in this regard, and there is some evidence that it can be helpful in improving outcomes after bullying. Some participants described improved relationships after surviving bullying and a deep desire to protect others and help those who were being bullied. Healthy relationship training can be beneficial to all students, including those who are bullied. Further, some survivors may be champions who can lead peer-to-peer anti-bullying efforts in their schools. In the larger study, many participants lamented their school's efforts for not reflecting their own experiences and for being led exclusively by adults who they perceived as being out of touch. Indeed, peer-led initiatives have long been identified as holding promise. It's also important to acknowledge that not everyone experienced PTG. Future research should consider what factors distinguish between those who experience post-traumatic growth and those who do not. Although important questions remain, this study demonstrates that even though bullying is traumatic, many survivors may experience some form of growth that may sustain positive social and emotional outcomes into adulthood. This has been a largely overlooked population, and there may be things that we can learn from those who experience PTG to help those who must cope with adverse experiences. Thank you very much, and I hope you enjoy the rest of the forum.